All right, we're going to go ahead and begin our session today. And again, my name, well, I don't know, I've not introduced myself. I am April May, and I am the Coalition and Leadership Director at MELA, which is the Mississippi Early Learning Resources. And we are a nonprofit based in Mississippi. And one of the things that we have going on, and I'll talk more about this in a few slides, is our Forum for the Future coalition. And based off our common agenda and a lot of the conversations that we receive from our ECE community, we have gathered together a lot of information for our common agenda, and we'll talk more about that in a few slides. But thank you all for joining us. Our objectives for today, I'm going to give you all a brief overview of the Forum for the Future. We're going to talk about the common agenda, which is was recently out of draft form and sent to our Forum for the Future members in January, which this month. And then we're going to have our presentation by Mickey Cotton, who is the Director of Member and Community Engagement. And the title of our session today is Chip and TrueCare 101, What to Know About the Children's Health Insurance Plan. A quote that we have for today is the future we imagine for Mississippi's children begins with the courage we show today. And you all are, I like this quote because sometimes it takes us to think outside the box and to be courageous and to think differently in order to make change. And that's some of the things that we wanted to do within our coalition. And one of our ways that we're thinking courageously is by having a goal. And our goal is that by 2030, hold on one second. Okay, by 2030, Mississippi's early childhood system would be state of the art, fueled by robust data, resources, and cross-sector collaboration to meet the needs of all children and families. So let me give you a little bit information about the Forum for the Future and who we are. The Forum for the Future is a coalition of coalitions. Right now, we are at 367 members and counting. We are committed to collective action for children and families. And together, we like to share ideas, coordinate strategies, and drive change so that every child in Mississippi can start and stay strong. And our Forum for the Future brings together the people and partnerships shaping Mississippi's early childhood landscape. How do we operate? We operate within what we call our collective impact, and here are our norms and our principles. You want to slide up above? Okay, some of our norms are we like to dismantle inequities. We like to balance power, which means that we focus on learning and responsibility, not perfection. We like to trust the collective impact process, which is to commit to persistence and non-closure. And even while we gain clarity and make decisions, there will always be deeper questions to address feedback, to integrate adaptations to make, and more to learn and do. And one of our biggest things that we like to say within our norms is that we like to overcome mistrust, which means we like to lean into discomfort and lean into each other. Because one of the things that I've learned in doing this work is that sometimes that people who are working with families, working with children, are the experts in the fields that are the experts, and it's okay for us to ask what's going on, what's happening, so that we continue to move this work forward. And the last one that I'm going to talk about is owning the work and be present. And we like to talk about this work as ours. It's not yours or mine, but it's ours. And so we like for everybody to think about this coalition and the work that we do as owning the work and saying we instead of they. One of the things that we are doing is that we are building a state-of-the-art early childhood system together, and I keep doing it to myself. Again, I told you our goal, which is very, like I said, courageous. And so by 2030, this is what we would like to achieve. We would like to have, and I'm going to go into our common agenda here. I mentioned to you all that the common agenda is ready, and Mindy might drop it in the chat for us so that you all can have it in your hands. And when you look at the common agenda, read about each of these issue areas I'm going to discuss, and you'll learn more about the purpose of the common agenda and why it's important for everyone to understand what we're doing within the forum. So the first thing we'd like to say is that when we think about our state-of-the-art childhood system, we want a coordinated, efficient system. So we want Mississippi's early childhood system to work together, state to local, to support families every step of the way. And how do we do that? We have our different priority areas. The first one is state of the art early care and education. And those are priorities there. You can see those on the left hand side of your slide. But just to highlight a few, is to improve outcomes, which means to strengthen children's health, learning, and development through quality early education. And then another one is to sustain the system, secure long-term funding and investment to maintain quality and growth. And so those things fall under our state of the art early care and education bucket priority issue. The next one that we have is strong families. And some priorities there, we like to empower families. We want to build a responsive, family driven system of care that meets families where they are, expand leave access. And so we want to ensure that we have access to paid family and medical leave for all caregivers because we know that is really important. And then we also want to strengthen child welfare practices and economic supports that help families remain secure and stable. And that falls under strong families. The next one we have is healthy mothers and children. And our priorities there is to build a responsive, we want to ensure equitable access to paid family medical leave. And then this is the hold on, y'all. I just realized that this is the same one as the other one. But we want to have access to comprehensive, high quality health care from conception. We want young children to live in healthy, safe environments, and we have actually worked on some funding for that. And then we want to have timely, high quality, and responsive mental health care. Excuse me. All right. So that's a quick rundown of our common agenda. Again, Mindy has posted the link in the chat so that you can have the copy of the common agenda on your computer screens. Now, I know I've talked a little bit about Forum for the Future and how many members we have, but some of you on the call may or may not be a member. We would love for you to be a member, and being a member means that you are aligning your organization or yourself on our prenatal to five issues in Mississippi. You will also have access to Mississippi focused resources like the Bill for Babies talking points, which we have been developing. And if there is something within early intervention, child nutrition, or early care and education that you want to talk about, but you don't have the data or you don't have the talking points to bring it up to someone, we've created that for you. And so becoming a member will give you access to those talking points. And the commitments are simple. We would like for you to participate in our meetings. If you can, come to our Capital Day. We have a State of Babies event that we do late spring, early fall. And all of this is just we're continuing to drive change in Mississippi for our families and our babies. And so membership is free. Mindy has posted the link in our chat there. And so if you want to become more or learn more about it, you can click the link for that. And the website is real simple. It's www.mississippifuture.org, where you can also find more information there. And our last thing that I'm going to share with you all today before turning it over to Mickey is staying in the know. We have created a GroupMe text group for our Forum for the Future members. This is going to give you timely updates. Sometimes we're not near our phones to read emails. And so we have recognized that and created this GroupMe. Within the GroupMe, if you are attending Capital Day, you will get Capital Day updates. If we're like, hey, we're meeting now in the Rotunda, you can have that on your phone. We will use the GroupMe to provide meeting updates, such as, like I said, the babies and our full coalition meetings that we'll be having. And this is also be just a way that we will have ongoing communications with our members. And so if you would like to join that GroupMe, please do so by scanning the QR code. And also the link is in the chat. So I want to thank Mindy so much for posting all of our things in the chat. You have the common agenda, the RSVP for our Capital Day, to learn more about joining Forum for the Future, and then to join our GroupMe. I know I quickly ran through the common agenda, but please take that link, take the time to read it and understand it. And if you have any questions, you can contact me, and I'll be more than happy to talk you through it if you need to. And I'll put my email address in chat too to get in contact with me. But at this time, I am going to turn it over to Mickey Cotton with TrueCare.
Thank you, April, and
You're welcome.
nice to see all of you guys virtually. I'm going to share my screen and go over a presentation, but I want this to be interactive. So if any point in time anybody has questions or what I'm covering, please just chime in. And I am going to share my screen real quick. I put together a brief little PowerPoint and just to cover with you guys. So let's see. 2 seconds. All right, let me know when y'all can see. I believe we should be good.
I don't see it yet. I just see. Oh, there you are.
Good. Awesome. All right. Well, so I'm with TrueCare, and some of you guys are probably wondering what TrueCare is. TrueCare is the new managed care Medicaid plan for the state of Mississippi. So the state of Mississippi has what they call their Medicaid program, but most state agencies do not manage their own benefits for a large portion of the population, typically the more high utilization population, such as pregnant women, foster children, Social Security recipients, or disabled living at home up to 65. So TrueCare is one of those health plans in Mississippi. We bid on this contract in late 2021. We were originally awarded the contract in 2022. The contract was signed in 2024, and then we went live in 2025. So it has been a marathon of events since 21, but we are here. We are so happy to be here, and we started covering lives in July, and we have a little over 100,000 right now across the state of Mississippi. We are in partnership in a strategic alliance with the Hospital Association. So St. Dominic's and Baptist and the large, those are the large hospitals, but then also rural hospitals like Magnolia Medical in Corinth and hospital in Winona. So we're rural, but also urban, just to stay abreast of what the communities need. So that's just kind of a little bit of an overview. And then CareSource is our strategic partner, and it's a national managed care company, and that's our geographic footprint. So we're right next to us in Arkansas as well as Georgia, and then the most recent go live was in Nevada. So as you can see, we're have a great footprint across the country. And one thing about CareSource is it started a social worker started CareSource, and CareSource is a not-for-profit. So we make a lot of decisions based on what our communities need and what we hear from the community, and not what our shareholders need. So that's one thing that we do. That's different. We have a very community-based approach. And working with the Early Learning Alliance, and working with a lot of nonprofits across the state of Mississippi who see our members, we're able to adjust and make sure that we are doing what's best for our communities. Here's just kind of a map. I oversee, in my role as community and member engagement, I oversee the community marketing team. So we're segmented into 3 sections across the state. We do a lot of events. We do a lot of maternal health events for pregnant women, making sure pregnant women know that they're getting the care that they need, and where to go to get care, and most resources that they need, whether it's diapers or car seats, just having access to those essential items. So that's kind of an overview. And then kind of what Mississippi Can is, you can, just like with your own health insurance through your employer, we have an open enrollment each year. We just concluded the open enrollment for 25 to start in 26, and then in October we'll begin open enrollment again in 26 for your health plan for 27, and that's the only time that you can change health insurance plans. So kind of an overview about CHIP. So what is CHIP, and Well, how will CHIP affect me is probably what you're thinking. Well, CHIP is the Children's Health Insurance Plan. It is funded by the state of Mississippi with matching funds from the federal government, and it's for those who are under the age of 19 who are uninsured. And so I'm not sure if you guys realize that, but there's about 7% of Mississippi's children do not have any form of health insurance, and which equates to about 54,000 children. And growing up, I grew up in the Delta, and I still live in the Delta now, but growing up, we didn't have health insurance as children. My parents owned their own business, and health insurance for us was just not a priority. Well, had we known, or had CHIP been around in the late 90s, all three of my siblings and I would have had health insurance. Then we probably would have gone to see the pediatrician and had a lot of immunizations and been up to date on a lot of things. Thankfully, we are all for healthy and that didn't affect us. But there's avenues that could now be taken, and so that those kids are covered and that they're getting the vaccinations that they need and getting the well visits that they need and just flu shots, or just having access to care. So this is kind of a chart of who is eligible for CHIP. And when I share this with groups, people think Medicaid, people think low income, absolutely. But then you look at the CHIP levels, and there are higher levels. And so I think a lot of folks within the state of Mississippi don't even know that they're eligible for CHIP. And they're paying a lot of money either through their employer or out of pocket for, a different type of insurance, maybe through an insurance broker, where now they can put their kids on CHIP. And this is kind of the income levels. And so, and all of this information is available on Medicaid's website. So it's all public information. And then moving on, this is how to apply for CHIP. And the application process is very seamless. You can either do it online or online rather, or go in person to your local Medicaid office. Or by mail. I would recommend initially to go in person, just because there are a lot of, just different application needs that might be a little bit more cumbersome to navigate on the front end. So there's a list of regional offices on Medicaid's website. There's typically one in every county. So that's one good thing about Medicaid, is they try to be where their members are too. So that's just kind of some overview of what's needed for CHIP. All right. And then what makes TrueCare different? So if and when you're eligible for CHIP, you can pick an insurance plan. And what makes TrueCare different from the others? Well, for starters, we have no copay for all of our CHIP members. So when you go to the doctor, you're not having to pay a $40 out of pocket or a $20 out of pocket, and those expenses can add up. So we wanted to knock down that barrier to access of care by not having a copay. One other thing that TrueCare does that is unique to managed care is we have care management. We have care managers within our organization who are Mississippians. They live in Mississippi. They live in the communities that serve our children and our population as a whole, and they help out with care coordination, so that in case the children are not up to date on something or have urgent needs, they can connect them with those resources, not just medical resources, but also those social drivers of health, whether it's, and I'll jump on down, whether it's transportation, helping them set up transportation to the doctor's visits, or I use this example a lot because I live in the Delta and my dermatologist is in Jackson. So I have to go to Jackson just to see a dermatologist. And, I'm in a position where I'm in Jackson a fair amount. So I usually, will make it work while I'm there. But however, if someone who sees that trip to Jackson as a burden to go see an endocrinologist or a dermatologist or a specialty, they're probably not going to go because, as we all know, gasoline is very expensive. Well, one thing that managed care does is we will reimburse for mileage to and from doctor's visits. So that's something our care management team works with as well, is showing the members and showing the parents on how they can be reimbursed for their mileage so that they feel, that it's not a burden to take their child to the doctor. Also, if you don't have a car, we have a partnership with the company called MTM where we set up rides for our members to go to non-emergent medical appointments. And so if you live in Shaw and you go to Greenville to the dialysis clinic, that's something we can work with them to set up recurring trips and making sure that they do have, a safe ride to and from the doctor. We also have an over-the-counter benefit. We call it a card, but it's like an online portal where you can go in and get Tylenol or Band-Aids or cough syrup, those things that you need each month that maybe you're having to pay out of pocket for. Also, we have a very wide array of rewards that we pay to our members just to make sure that they are getting the care that they need. So incentivizing them for that good behavior. We do rewards around flu shots and dental cleanings and visits. Pap smears and mammograms. So that's something that we're real focused on, the quality of care and making sure folks are staying on top of their health care on the preventative side. But then we also have our youth activity fund. We have partnerships with Boys and Girls Clubs and YMCA and Salvation Armies that offer after school, either tutoring or care after school. So we have partnerships all across the state where we will pay up to $40 a month for our members if they attend a club, just to have a hub for those children to go to that's safe and that they're able to do their homework and get a good snack, as well as health and exercise. So that's something that we will offer and for our members. And so far that is very much so. We've heard great things about it, and our members are very happy that we're able to do that. And I'll kind of keep going on with just some rewards that we have. We also have employee and education coaching that we're going to launch later this year, where we have life coaches who will work with our members if they want to go back and complete their GED or a high school equivalency course, or if they're interested in some sort of trade, we'll connect them with the resources that they need so that they can, fulfill a goal that maybe wasn't attainable earlier in their life. We have a very robust app that's, like you mentioned earlier, April, that with the GroupMe, people have their phones. They may not always be checking their email. They may not always have their Medicaid card with them. So having an app and able to access that is something that we found that the members really like. We also have we're learning that asthma amongst children is really high in Mississippi. So we have an asthma remediation program where we send free bedding to our members who have an asthma diagnosis so that they can, reduce the exposure to environmental triggers. So that's something that we offer that's a little bit different. Continuing on, we have My Strength is also, it's a really good tool. It's something that I know I can use from time to time, especially if weather's coming or during this, cold weather and whatnot. But we have an app that's wellness resources and daily inspirational quotes that's free to all of our members. We also, My Resources is something I talked about a minute ago, the social drivers of health. It's if you live in, say, Byram and you need a food pantry, and I know that happened a lot with the SNAP shut down earlier or late in 2025, rather, that a lot of people were wondering where food banks were in their communities. And so we have My Resources. That's a tool that you can search by zip code to see where are the diaper banks, where are the food pantries, where's my local WIC office, where's an employee the local WIN office. So those are things that we found, or community-based organizations that may provide lactation consultant or prenatal care. So that's really good tool that we have, that we found that kind of connects our members with the resources that they need. We also do community-based partnerships and outreach. That's kind of how I got connected with the Mississippi Early Learning Alliance, was through a partnership last fall. And I do a lot, like I mentioned earlier, we do a lot of events. We do give out diapers. That's one thing that we have seen. There is a huge diaper insecurity and huge diaper need in Mississippi. So we try to attend a lot of baby showers. There's a huge maternal health focus right now from a state level. So we're trying to just kind of meet that need. And we have a specific pregnancy program that if you're enrolled in TrueCare, there's a mom and baby beginnings program for all of our mothers that's more hands-on care management support that they need, and kind of focusing on the mother holistically. We also have tons of online resources on our website, as I mentioned before. And here's just some pictures of us out in the community from late summer, early fall. We do a lot of back to school events where we provide school supplies for kids and parents, because we know that is an added expense for them. And so that's something we can help out with. There we were at the large event that the Early Learning Alliance had in Jackson, so we were happy to attend that. But we're statewide, and we just like to be able to reach our members where they are, and also work with our partners to help strengthen the state as a whole. And there's just my contact information. If you guys have any questions, I'm happy to talk a little bit more about the presentation itself if you guys have questions.
Well, thank you so much, Mickey, for all of that wonderful information. And now that when I'm looking back at my slide for our health, for our healthy mothers and children's priorities, and after seeing the resources that TrueCare offers, we are right. It's a perfect alignment for us having you join us today. And so we do have individuals on here that work with child care centers. And so we hope that this information for you all was valuable, and that you will share it with your families that you encounter every day. And so I thank you all so much, and you all have a great weekend.